It was just a constant dull ache. No matter what I was doing, no matter how I would lay in bed, and I got to where I wasn't driving over to see my family in Napa, my arms in the steering wheel, and that rib pressing, I was feeling very weak. I would get dizzy, lightheaded.
Thoracic outlet syndrome is a syndrome that involves 3 different structures as they leave the chest and go into the arm. There's the subclavian vein, there's the subclavian artery, and then there are the nerves that go from the neck down to the arm itself. And it can occur on either the left or the right side. But it involves the nerves or the artery or the vein being compressed within the structures around the neck.
Thoracic outlet syndrome is a myriad of symptoms that occur in patients who have trauma or overuse of their upper extremities.
The most common people that get thoracic outlet syndrome that involves the vein are people that do repetitive motion. Swimmers, because they do repetitive movement of overhead stretching their arms out as they're swimming. Pitchers, who do repetitive movements in terms of the way they throw the ball.
And the other half of patients may have had an accident where they actually have trauma.
In 1987, I was in a car accident where I was hit by a drunk driver. I had a lot of damage to my chest, specifically the left rib. Our thought now that we know it was thoracic outlet syndrome is that the ribs that were broken had healed in a way that over the years they had gotten calcifications, and it became very deformed, and that deformity was pressing up and compressing all of the nerves in that subclavian vein area.
There's no real test that tells us that it is thoracic outlet, especially the pain and discomfort one. Many of the tests will be negative. They'll have an x-ray of their neck that's negative or an x-ray of their shoulder that's negative. And it's rare that you have an extra cervical rib, maybe 10%. So most people, it'll look normal. The main thing is a good history, a good physical, and listening to the story, and then figuring out that that's what they have. So the 3 things I use on my exam that really help me diagnose neurogenic thoracic outlet is tenderness in the scalene muscle here. When I raise their arm, I can put my stethoscope here and listen. I can hear a bruit, which is a noise in the artery, reflecting some compression of the artery. And then the elevated arm stress test is when you put both arms like this and pinch. And if you have no thoracic outlet, you should be able to do this for 3 minutes without numbness, tingling, or any discomfort. Those with thoracic outlet will get numbness and tingling. Their 4th and 5th finger will quit working, and they'll start dropping their arm a little bit because it's tired.
I mean, here I had 3 years of all these appointments with doctors and, not sure what it was, all these exams, and then here this one was so quick with her. Hi, how are you doing? And, yep, and she touched my neck here, which, was pretty swollen and very puffy, and she just, within a matter of just a few minutes, she was very confident that that's what it was and she could fix it.
The minute that a patient gets diagnosed with thoracic outlet syndrome, the real question is, what type do they have? Do they have venous? Do they have arterial? Do they have neurogenic? Or do they have a combination of arterial and neurogenic thoracic outlet syndrome?
Well, not too many people operate on thoracic outlet syndrome in the whole country. There's probably 5 to 6 centers. We make an incision underneath the arm, go in and remove the rib, the scalene muscle, preserving the vein, the artery, and nerve. The operation takes about an hour and a half, and they stay in the hospital 1 night. And then they go into physical therapy 2 weeks after intervention with surgery. And again, hopefully now they'll improve because the rib's not there pushing on the nerve.
Immediately when I woke up, I felt better, other than the physical pain of the incision.
And I have a whole team now of about 5 of us that can do this procedure and help get them in and get diagnosed and treated.
I truly feel like I've gotten my life back, and it's just amazing. And I have all the faith in Dr. Humphreys and Dr. Freischlag. They're both my heroes.